My name is Pumla. I have been in the nursing profession for 53 years. Started nursing in South Africa in general and midwifery throughout my lifetime. I think I've delivered more than 4,000 babies. My main reason for going into nursing really was to make a difference in my own society because, I could see that things weren't equal and there were very few people who stood up for the inequality at the time. They were cutting costs in our hospital. We didn't have enough medications. We didn't have enough beds. Sometimes patients were sleeping on the floor in the hospital. And a group of us took pictures with some other doctors. Those days, if you spread anything against the system, you were arrested. Eventually, they arrested 5 of us. I then realized that working through this as a layperson, as it's so called, it's dangerous. So I decided to join a religious order and think, that's more protected. I can still do the same thing, but if you're arrested as a Catholic nun, it's big news. But as me, no one cares. We were doing a change for post-apartheid South Africa and looking at especially the homelands where 20 babies were dying per day of malnutrition. So we did research and we could have documented evidence of the problem, and the government didn't like that. They had a list of people they wanted to eliminate because they were going against them. And I thought, I can't risk the kids, because they actually shot in the house twice. I moved to Australia in 1992, and then in 1995 we moved to Cobar, where I was practice manager of Cobar Medical Practice. I was there for 14 years. And then I went to work in Manly. My experience was people wouldn't even hesitate to say very racist things during handover. One manager said to me, Pumla, being from South Africa, you wouldn't know what first world medicine is. I said, no, but the first heart transplant in the world was done in South Africa. So why would you say something like that? At the time, I was starting to question my sanity. Is there something wrong with me? Why am I seeing all these things when everything is okay? People were scared to speak up and everything. Once I joined the Carl group, I felt, there's more people experiencing this, and it is true, and I started to feel normal. I was like, okay, I'm not crazy after all. I was like, wow, there's so many who are prepared to speak up. There are so many who are prepared to really be involved in changing things for nursing. When you see more people who are experiencing the same thing, it doesn't take it away, but it feels manageable. I feel really grateful that people acknowledge my input in the Carl group because my life experience, even in the convent, was if I did something, I got into trouble. We are one. We are all nurses. We can work on it together and promote inclusivity, and it's in the interest of everyone.